You?
It's always nice to see you.
So tell me a little bit about CloudBreak.
Sure. CloudBreak is a unified telemedicine platform and one of the first ones in the country to bring all of your specialties together on a single platform at the push of a button, integrating other support services like language services in the mix.
Yeah.
So if you have a telestroke patient who speaks Spanish, we can do that all on a single encounter, very patient-centric, and it makes the provider's life 10 times easier.
Yeah. Yeah. It's interesting you provide services with the platform.
Yes.
But your names of companies always interest me. So I've always wondered, why did you name it CloudBreak?
Yeah, it's a great question. One, we live in California, right? So part of that was a surfing homage to the CloudBreak break in Fiji.
Sure.
But the real driver behind it is there's so much noise in the healthcare industry, so many solutions that are out there, that it really, to us, formed an overcast sky of what solution do we go with?
Yeah.
And we thought our solution was going to be that ray of light, that one solution that really solved many of our clients' needs with a single platform.
Yeah.
And so that CloudBreak name really was like the hope of a better healthcare solution.
That's awesome. So I've been following you for a while.
Yeah, me
since
too.
We met a couple years ago at HEMS. Tell me the progress that you've made with CloudBreak. It's from what I know, you're adding a lot of good hospital partners to your system.
We are. We are now at almost 700. I think the number is now 697 clients nationwide. Awesome. We connect to our clients over our own private broadband network. So we've actually built one of the largest private broadband networks into healthcare in the country. Yeah. So all of our hospitals can now break down the silos and collaborate over that network together. It's been an amazing ride over the last few years. You know, we're growing at 65 to 100% a year fairly consistently.
Oh.
And keeping up with that is a big effort.
Yeah.
But the stories that come out of the use of the system every day are really empowering. You know, a limited English proficient and deaf and hard of hearing patient who's finally understood for the first time and what could be the scariest time of their life in an ER. Yeah. And then to see the life-saving applications that we're now moving to in telestroke and telepsych, it's really gratifying.
One of the things that I've always appreciated about what you're doing at CloudBreak and the mindset that you take with the company, from my view, has always been about the patient, about the experience of the people. Can you elaborate a little bit on why you believe CloudBreak to be so unique in that perspective? You talk about the stories. Tell us some stories and why that makes CloudBreak unique.
Sure. So my background prior to CloudBreak, I was CEO of an ER hospitalist and anesthesia group in Southern California called Emergent Medical Associates that saw about 1 million patients a year by the time I left. And one of the things I noticed is we all talk about being patient-centric, but who's focused on the provider, right? We felt like that fourth leg of the quadruple bottom line was constantly being ignored.
Sure.
Providers now have a very difficult time. We're asking them to do more with less from a reimbursement standpoint. We're asking them to document in an EMR where it seems like no one's really done any great UI, UX design on, right? You're always talking about designing for people, right? The EMR industry could learn something from that. And I think we're starting to see a lot of EMRs move in that direction to making that user experience for the provider get to a better. So our slogan is #HumanizeHealthcare, and it's all about restoring a little bit of the joy back to the provider of their calling. And if we can do that, we feel like the patient problem is then going to be solved because a provider that's not burnt out, that actually enjoys what they're doing, is going to take better care of their patients.
Oh, that's awesome. I mean, we were talking earlier about how do you know from that perspective that CloudBreak is being successful? What do you measure that tells you you're humanizing care? How do you know?
Yeah, I think there's two different ways that that's done around the telemedicine space. And the way that most people are familiar with now is cost avoidance. Were we able to reduce a readmission? Were we able to get the patient the right care that they needed at the right time from the right level of provider? Whether that be mid-level or residency trained board certified physician, right? So that's one side is the cost avoidance.
Which makes sense, it's critical.
Yeah, if you take a look at some of the studies that the VA have done, they've saved, I think the number was $83,000 over the life of a patient because they were able to cut travel time and all that type of stuff out of the patient encounter. And the patient satisfaction scores went up because the patient was able to be treated where they're most comfortable in their home, right? So there are those types of ways to measure it. And then now we're getting into the revenue driving part of it and how people get reimbursed for telemedicine. So with the advent of parity states and a lot of the work that's being done at the governmental level, and especially with the payers, some of whom are displaying here today, a lot of that work is going to help drive a better ROI going forward for people who are investing in platforms like ours.
And I love this humanizing healthcare concept, as you
Yeah.
know. I think it's based in empathy.
Yes.
Tell me more about CloudBreak's culture from that perspective. You've grown quickly. There's something right there,
Yep.
clearly. What is it about the culture of CloudBreak around humanizing healthcare that you as a CEO are driving to try to influence not only your company, but the industry as a whole?
Yeah, a lot of times you'll hear companies say the client's always right.
Sure.
I'm not sure we believe that all the time,
Yeah.
but what we do is we work to make them happy. And it's our job to be their trusted advisor, and in moments where they're not right, help bring them around and educate them to the point where we're saying, well, this is the way that things are currently being done. Let us share our best practices with you.
Yeah.
And I think a lot of it is just our dedication to client service. So we as a
Yeah.
technology company, we don't just drop technology off at the door
Sure.
and then say, it's super easy to use, push a button on
Yeah.
the screen. Now, by the way,
Yeah.
it is super easy to use, and all you have to do is push a button on a screen.
Yep.
But we support that with people that we put in the field that we call client advocates. And we
Oh,
view
cool.
those client advocates as folks who we pay for, but they're really employed by our clients. And their goal is to make sure that they round on all the equipment and make sure it's
That's
in good
cool.
working order. That during during flu season, they'll go and they'll do in-servicing on nurse registry. They are there to
that's cool.
support the client
Yep.
in whatever facet is necessary. They'll work with that difficult physician who says, I've practiced this way for 30 years. I don't need telemedicine. Because when you're dropping off these platforms and you're trying to change someone's practice style, that's culture change, right?
Yeah, that's tough.
So there are culture
Yeah.
change catalysts, and I think that's, again, we put people in the field to help humanize the technology.
That's awesome. I think, you and Nick, Pink Socks,
Yep.
and I, and
Yeah, there we go.
Cancer Geek and Bill have been exchanging this notion of empathy-driven innovation for a while.
Yeah.
So when you take a step back, even beyond CloudBreak, and look at this part of the industry as a whole, what do you see that's good? What do you see that you hope to change and influence?
Yeah.
Because we're on an early part of a very long journey. What are you seeing? What do you really want to impact?
When it comes down to the industry and you take a look at patients being more engaged in their care,
Yeah.
in order for a patient to be an educated consumer of healthcare, they need good information. And if we asked everyone at HIMSS to raise their hand and say, how many of you have access to your patient health record? Not that many people are going to raise their hands,
no
right?
kidding.
And if they
That's
did,
right.
they don't have access to all of it because they have a primary care doc. They have, when they visited such and such provider here.
Yep.
So there's a lot of silos that separate all these different systems, and
Yep.
health data exchanges haven't been fully successful in terms of getting people to share that information.
Very true.
So I tell you, interoperability is a big driver of that. So we've
Yep.
done that in video. Our video platform allows any Cisco, VidYO, Skype for Business, Polycom platform that a hospital's invested in
Yeah.
to talk with another, right? Because we're an open standards-based platform. So Telemedicine 1.0, pick up your phone, call your doc. Telemedicine 2.0 was let's integrate video, but people integrated WebRTC because it was really affordable, but by
Yep.
its definition, it's not interoperable. So our goal was to not have to go into a hospital and say, rip out what you have and use us.
Yep.
It was to say, you've already made this investment. Let's turbocharge that investment and make it even more useful. Let's make you a provider as well as a consumer of telemed. Let's make that a two-way telemedicine superhighway.
So one of the things, and just a couple more questions.
Yeah, no, this is great.
You talk about collaboration a lot and
Yeah.
the ability to openly collaborate between systems. Why is that important? Why you mentioned that, and there's something there. Tell me more.
I think it's important because most of the things you'll read will say we have a physician shortage in this country, right? What you've
Yeah.
seen in the evolution of the medical education system is an increased specialization
Yeah.
and fewer people going into primary care, right? Or internal medicine, as the case might be.
Yeah.
So these telemedicine gatekeepers and care coordinators that we used to have don't exist today. And so technology, one, can help fill that gap.
Yep.
But two, it can really help a rural health system access specialists that they need because those doctors aren't moving to that rural area. And ironically, there are just as many medical deserts in some of our nation's largest cities as there are in rural areas. And an example of that is one of our clients, Avanti Hospitals, who is an inner-city health system, 4 hospitals, each about 100 beds, serving a very underserved patient population.
Yeah.
They wanted to become accredited stroke centers, and they didn't have access to those neurologists on staff who could provide that service. So we helped them solve that problem. They were a language services client of ours.
Sure.
And we helped them solve that problem by creating a deal between them and the University of Southern California, where they could get Tier 1 academic stroke consults, and they recently got their stroke accreditation. So those are the problems that telemedicine can really help solve. And it's not just about telestroke and telepsych, which are some of the primary use cases. Tele-GI, telenephrology, teledermatology. Any specialty can integrate telemedicine. And the great thing about our platform and what we do is we customize the workflow to fit the physician, as opposed to demanding the physician to customize their workflow to fit us, which really drives better adoption.
You know, when I think about this, and maybe just one more question.
Yeah.
When you talk about it, almost sounds like tele-me.
Right.
It's all about me. If I'm the provider, if I'm the caregiver, if I'm the patient. And last question around this, when we think about caring for people in place.
Yep.
Why is this so important? This is clearly a passion of yours and has been for a very long time. What drives you?
So part of why we created an any device, anywhere, anytime platform was because of population health. And most people define population health a little bit differently than we do.
How do you define it?
The norm is, how do you treat a chronic disease state in a given population in a given area?
Sure.
Our version of population health is, power to the people. Let's give them healthcare on their terms.
Yep.
Right? Yep. And so we're going to be coming out with our patient portal next month. And it's going to be able to follow the patient all the way from home to the hospital to place of disposition, whether that be home again, or whether that be LTAC, skilled nursing facility, whatever it is.
That's awesome.
A local healthcare system is going to be able to support that patient on the entire continuum of care on one IT platform. And that's really the goal, is building that connectivity, building that community around the patient, and giving the proper support to the provider so that they know they can focus on care while we focus on the technology.
I think that's a great way to end it, and I'll ask you to just leave us with some good parting wisdom comments that you've always been willing to share. But I like the notion of a community around a patient, but also around that caregiver, because we know there's a lot of burnout. But if you were to leave us with some thoughts that you think we need to be thinking more about from your perspective, what would you say?
For me, again, it goes back to the patient as what I would say the owner of their healthcare team, right?
Yeah.
I think our healthcare system has allowed patients to kind of sit back and be a receiver, and we're all about giving people great care.
Sure.
But what we should be doing is empowering patients to take better care of themselves.
Yep.
And so giving them the tools to do that, giving them tools like telemedicine where they can hit a button, get a provider consult on demand, having great data on their own health. I think we were talking before that I've recently changed my diet.
Yeah,
right?
You look great, by the way.
Thank you very much. Thank you very much, No, but a piece of that was me becoming a better consumer of my own care and taking a little bit of ownership of my diet, right? And saying, you know what, I want to bring my triglycerides down. I want to improve my HDL, LDL levels.
Sure.
And the only way you get there is by showing people that they can, right?
Awesome.
So for me, it's about making the patient the owner of their care team, having the doctors be their coaches and teammates, but making sure that they take some ownership.
It's awesome. So good to see you. Thanks
Great
for
to
all
see you
you're
as well.
doing.
Thank you for the time.
And enjoy him. It's good to see you,
you
pal.
too.
Awesome. Good to see you.
Have a great rest of the show.
Thank you. I will.